Can you talk a little bit about the ways insurance company needs to approve or authorize the care? And I couldn't read the end of that one. Yep. So Stephanie's asking, can you talk a little bit about the ways insurance companies need to approve authorized care members as a way to save money? Okay, thank you, Stephanie. I love the question. So what happens is, let's say you need a surgery. Maybe you need a knee replacement. You're going to have to get that pre-approved or pre-authorized by your insurance company, because that's who's paying the bill, basically. And unless it's an emergency, which hopefully it's not, you do need to get that prior authorization. And what the insurance company may look at is saying, well, is this really medically necessary? Like, gosh, have they tried physical therapy? Have they, tried this, that, and the other? They can also say, are they going with in-network providers? Are they not? So there are ways that you can help save them money and also save yourself money, because I will tell you that sometimes when you go to an out-of-network provider, the insurance company won't cover anything out of it. So for example, on that one, say you want to go to a specialty pharmacy, specialty pharmacy A. They are in network, so that's a bonus. And if you want to go to specialty pharmacy B, the insurance company might not pay for any of that, or sometimes they'll pay 50% of the charge on an out-of-network provider. So it's really important to understand who's in, who's out, and follow the rules. All right, so Maya is asking, and Lynn, tell me if I'm missing anything. Maya is asking, what is the difference between medical groups and insurance? Sometimes the doctor is in network with the insurance company, but not with the medical group. I'm not sure why. Oh, Maya, that is a question that a lot of us have. Medical groups kind of seem to be a thing more in California than in other states. So what you need to do, I don't know exactly why. Part of this, it mostly has to do with contracting, and that's kind of behind that curtain that we don't really see. So you really just have to make sure before you get the care that you're getting it authorized, that you've checked that your providers are in network. So sorry, I don't have a better answer on that one. Stephanie Dansker, I'm going to call on you because you might have the answer for this one.
I think sometimes it's really tricky because unless you really dig deep to find out, you may think that everything is covered. So if you don't ask, you may not find out. Sometimes it can be complicated. You just have to learn as much as you can to avoid being surprised. It's supposed to be clear, but sometimes it's not.
Stephanie, absolutely. Sometimes it's just not clear. And so as you're researching to make absolutely sure that you are using an in-network provider that would be in network for the insurance and the medical group, make some phone calls or check online. If you make some phone calls, take notes, because that way you can say, gee, on March 23rd, I talked with your customer service representative, Joe, and he said that that doctor, in fact, was in network. So you take those notes, and if I'm paranoid, if you're just researching it online, I take screenshots to say, look, when I booked this or when I had this service, this provider was in network. Because you can get adjustments. You can get denials overturned. You can get some charges reversed if you have your stuff together and you've really got all the facts. Okay, so the next question I'm seeing is, sorry. Oh my gosh, Lynn, I lost it in the chat. There was a question about GHPP. Oh, and Maya, I'm going to answer you, Maya. I can see you in the chat. So yes, check if doctors are both in the medical group and the insurance network, which is kind of a pain in the tail, but it's really kind of necessary. Lynn, are you seeing other questions? Oh, Lynn, I can't hear you.
Hey, Elizabeth, this is Mike.
Yes,
Someone wanted
Mike.
to know the difference between GHPP, MediCal, and Medicare.
Oh, that's a long question. So I will try and make this short, but thank you for the question. So GHPP is a program that is only in California. It's the Genetically Handicapped Persons Program, I think. And what that does is there's certain select diseases that are covered under this GHPP. So it's kind of like an insurance company, but the state pays for the care. So it's public. You have to apply to get in there, et cetera. So that's GHPP, and it acts like a managed care company where you'll have providers that are in network. MediCal is California's Medicaid. That's what it's called in most states. So MediCal is a public insurance program where it's typically, it's most often your eligibility is based on your income. So if you make below a certain amount, you do qualify, and then the state and the federal government pay your health insurance for you. If you don't qualify, if you make too much money, then we have to go figure out something else. And Medicare is another public program. It's for both folks who are 65 and older. There's a couple other criteria, but typically it's for folks 65 and older. And it is not free. Medicare has a lot of cost to it. I think a lot of people just tend to think, oh, it's a public program, it's free. It's not. So does that help, Carolyn? Or do you need any examples?
Yes, thank you so much. I think Medicare is free if you have Medi-Cal.
Yes.
But then is it worth applying for GHPP? Can you have all three? And is it worth going through all that, or will it affect your current coverage if you have Medi-Cal and Medicare?
So I love it. That's a complex situation. If you have Medi-Cal and Medicare, you should have all your costs covered. GHPP is always, it's called the payer of last resort. So if you have no other options, then you can apply to GHPP. So it sounds like in this situation, it would probably be best for the person to stick with Medicare and Medi-Cal. And you wouldn't, if you apply to GHPP, you won't get punished or scolded. They'll probably just deny you.
Thank you so much.
All right, Lynn, I'm not seeing anything else. Gosh, private insurance is always going to be the first payer. Again, GHPP is the payer of last resort. So typically, if your insurance, your private insurance is paying most everything, you shouldn't need GHPP. However, if you've got a plan where they aren't covering certain things that you need, and you think GHPP would cover them, then you certainly could apply. But understand that GHPP does have an enrollment fee annually. So you'd want to kind of figure out, kind of do the math of, gosh, if I need this care that my private insurance company isn't paying, that I might have to pay for myself, is that more or less than if I pay this annual enrollment fee for GHPP? Like, which way monetarily works out better for you? Dun, dun, dun. Yes, and Lynn says, depending on your income, the enrollment fee could be zero. Yes. All right, any other questions? Oh, great discussion. I really appreciate everyone's questions. Love it. And thank you, Lynn and Stephanie, for the
And thank you to our public policy and advocacy webinar series sponsors, Takeda, Sanofi Genzyme, BioMarin, Pfizer, Hemophilia Alliance, and CSL Behring. With traducción al español, Spanish translation provided through a grant from Takeda. And thank you for joining us.